C-spine oblique projections can be taken in an AP or PA orientation. The patient can be either standing upright or seated. They can be supine or in a recumbent position that's comfortable for them. Because oblique projections can be AP or PA, this will alter which direction you will tilt the tube. For AP projections, the tube is tilted 15 degrees cephalic and 15 degrees caudal for PA projections. Oblique projections are named for the portion of the body that touches the buccal. So for example, if we take a left anterior oblique x-ray of the C-spine, that implies that the left side is positioned up against the buccal, and vice versa for right anterior oblique x-rays of the C-spine. That implies that the right side was positioned up against the buccal. Knowing this will be important for exam purposes when asked questions pertaining to patient positioning and which IVFs are being viewed. Anterior obliques generally show the same side IVFs, and posterior obliques show the opposite side IVFs. So knowing that, we can imply that LPO and RAO are for the right intervertebral foramen, and the RPO and LAO positions are for the left intervertebral foramen. Say that the patient was either in LAO position or RPO. On the image to the right IVFs are shown, and you could say that the patient was in RAO or LPO position. Here are some criteria for oblique C-spine projections. Proper collimation and marker placement is necessary. Centering at C4 will ensure that the image includes C2 through T1 of the vertebral column. Open IVFs closest to the IR is another evaluation criteria. Open intervertebral disc spaces and elevated chin also is another evaluation criteria, making sure that it doesn't overlap any anatomy. And that's evident by the visibility of the bodies of C2 and T1 of the vertebral column. The intervertebral disc spaces are also open, and they're important to help rule out stenosis. And I also have the left pedicle kind of circled in blue, and it's kind of faint and kind of like in a symmetric, like lined up in the middle of the bodies of the C-spine, and those are important for the image analysis part. To demonstrate the IVF of the C-spine, it is necessary to rotate the patient at a 45-degree angle. In this image, the IVFs are circled in red. You can see the IVFs are not fully open, and the intervertebral disc space are not visible as well. But a key indicator that can help you identify whether the patient need to be rotated a little more is the opposite pedicle that has a blue line arrow pointed to it. In my previous slide, I put a star by the left pedicle, and my reasoning for that is to help you identify whether or not the patient is under-rotated or over-rotated. In this particular image, the opposite pedicle is almost outside of the vertebral bodies, indicating that the patient is under-rotated. If under-rotated, the foramen will be narrow and small, and the SC joint will superimpose over the vertebral column. So repeating this image, I would rotate the patient a little more to make sure I get a quality image. The key indicator, again, is the opposite pedicle, which has the blue arrow pointed to it. And the opposite pedicle is almost like in the middle, or almost close to the IVFs. Over rotation of more than 45 degrees would cause one pedicle to be foreshortened, while the other pedicle aligns to the midline of the vertebral bodies, which is clearly demonstrated in this image. So for this image, I would rotate the patient back a little bit and probably tilt the chin a little more to get a quality image. One of the most surprising things I learned doing this project was that the PA oblique projection is preferred because it reduces radiation dose to the thyroid compared to the AP oblique projection. Throughout my clinical rotations, I've only seen one tech perform oblique C-spines that way. Everywhere else, it was always AP oblique. And knowing this information, I'm definitely going to reconsider how I approach oblique C-spines and probably make some changes about how I do things. But thanks for watching, and hope you enjoyed the presentation.